Hi everyone, I'm Dr. Rodriguez, and today I'll be talking about acid-base disorders, a topic that often raises questions among healthcare professionals and patients alike. Let's dive into some common questions I often encounter.
What are acid-base disorders?
Acid-base disorders refer to imbalances in the body's pH levels, which can disrupt normal physiological functions. These imbalances are categorized into acidosis, low pH, and alkalosis, high pH.
What are the main types of acid-base disorders?
The main types include respiratory acidosis and alkalosis, caused by changes in CO2 levels due to hypo or hyperventilation, and metabolic acidosis and alkalosis, caused by changes in bicarbonate levels due to various metabolic factors.
How do you diagnose acid-base disorders?
Diagnosis involves analyzing arterial blood gas (AB) results to assess pH, partial pressure of carbon dioxide (CO2), and bicarbonate (HCO3) levels. Additionally, clinical assessment and consideration of underlying conditions are essential for accurate diagnosis.
What are the treatment options for acid-base disorders?
Treatment depends on the underlying cause and severity of the disorder. It may involve correcting the underlying condition, administering intravenous fluids, adjusting ventilation, or providing medications such as bicarbonate or respiratory stimulants. And that's a wrap on our brief overview of acid-base disorders. Remember, understanding these concepts is essential for providing optimal patient care in various healthcare settings.